Hello and welcome. Thank you for joining today's webinar, Promising Practices, a discussion on an important topic and subject for the human workforce of human services. I am going to provide a little table setting for today's discussion and walk through the agenda. We ask that you ensure that you're muted and that your cameras are on or off as you'd like for today's discussion. Our agenda includes a plenary discussion with key experts from states, counties, and territories. We will also have a video that provides firsthand counts of those who are working in human services workforce across our industry, from child welfare to child support, even our Office of Refugee Resettlement work. You will hear remarks from our Principal Deputy Assistant Secretary, Jeff Hild. And as I shared earlier, experts from our plenary discussion. And then you'll have the opportunity to deep dive into breakout sessions on state innovations, local capacity, and territorial transformations. After those breakouts, we'll have one person from each breakout session report back on what were the primary topics that were discussed. As I shared earlier, we will have a Voices from the Field video that I'd like to have you all hear from now.
So I chose to work in the human services child welfare field because I'm passionate about the work that we do. And I knew I wanted to be a social worker at a very young age. I have lived experience as a biracial adoptee, and both of my parents are psychologists. Growing up in a household of the helping profession, as well as with extended family that worked in the helping professions, hearing the work that they're doing, hearing their stories about working with children and families, always just stuck with me. It became very much a core part of who I am and my beliefs. And so I knew at a really young age that I wanted to go into this field.
I think the most immediate challenge is just building and sustaining our workforce. We're in a period of time which we've been kind of deeming crisis, where some county agencies are facing upwards to 70–80% vacancy rates. And even though we know that's not happening in every county, we really are working hard to try to get our arms around that and try to rebuild our workforce.
Post-COVID, abuse and neglect, mental illness, domestic violence, crime, all of that has contributed to an increase in the workloads of our child welfare department, and the need for support, for homes, for crisis support agencies to be able to be present and respond as quickly as the need arises.
My hope is that leadership can continue to grow and continue to reach back and lift up the frontline staff, continue to develop and grow. I would love to see, more folks staying in this profession, more folks wanting to come into this profession, knowing that what you do here matters every single day, every single life that you touch. They will remember that.
So my hope for the future is that we generally have a better product, that we adequately resource families and communities and the communities that they live in, because we know they're doing the lion's share of keeping children safe anyway. I feel like we need a well-supported and well-paid workforce, and more focused interventions on the real root causes for children coming into care, like poverty.
That our agencies become completely bridged and, move kind of in a lockstep, that we are all communicating closely, and that the needs of our families are taken care of together. We share information, just a way that we can, meet the needs and make it as easy as possible to do so. We want kids and families to be safe and happy and thriving together. That's my hope for the future.
As you can hear from their stories, they're passionate about being a part of the human services workforce. They're facing some challenges, but also have hope for the future. With that, I will ask our Principal Deputy Assistant Secretary for ACF, Jeff Hild, to provide us some opening remarks.
Thanks, Deborah. Greetings and welcome, everyone. I'm Jeff Hild, the Principal Deputy Assistant Secretary here at ACF, and it's wonderful to be with you today. Before we jump in, I want to make sure that I thank our Deputy Assistant Secretary Johnson and our Office of Regional Operations Director Carlos Williams for all of their work to bring this group together today. Thanks to you both for being such great colleagues and leaders in this space. I also want to share my appreciation for all the volunteers who participated in the Voices from the Field video. I thought I saw Serena and Leslie on today, and perhaps others as well, so thank you. And also to all of our great panelists who will be sharing their expertise on today's session. Thanks for being here. It's no secret that as we emerge from the pandemic, many sectors of the economy are experiencing workforce shortages, and the human services workforce is no exception. For our human services workforce, some of the challenges go back to the Great Recession and its aftermath, and the pandemic has undoubtedly made the need for action urgent and critical. A number of state human services agencies are reporting all-time high staffing shortages, with sometimes 15% of agency positions persistently vacant. In addition to stress, workers increasingly report higher caseloads or ratios, longer hours, and even inadequate supervision. We know that these staffing issues can and do have a direct impact on families' abilities to access critically needed services in a timely manner. I want to talk to you about some of the steps we at ACF are taking. Like all of our priorities at ACF, addressing workforce issues is grounded in a vision of an equitable, effective, and accountable health and human services system that centers the needs of families across a wide variety of circumstances and delivers services to people when, where, and how they need them. At ACF, we're also committed to being proactive in supporting and growing a diverse workforce and promoting recruitment and retention strategies to ensure our human services workforce reflects the racial, ethnic, and linguistic diversity of this nation. So here are some of the examples of the work we're engaged in. ACF has been facilitating conversations with local and state partners to develop solutions to workforce issues across the country. One event brought together human services executives, allowing them to collaborate on solutions to their own workforce challenges in their states and territories. Another provided a peer learning exchange with state leaders in the Pacific Northwest and the Children's Bureau, allowing ACF to hear about state experiences and generate ideas for how we can make changes at the federal level to support this work. We're also tackling the problem through funding and through our budget proposals. ACF has obligated $350 million in American Rescue Plan funds for child welfare programs that help to stabilize state budgets. States are using these funds in innovative ways and are implementing a range of approaches, including workforce analysis and data-driven capacity planning, adopting a trauma-informed culture within their workforce, and building comprehensive training and workforce development systems. We also obligated nearly $24 billion in child care stabilization grants through ARP, which has served as a lifeline to child care providers across the country and kept many centers open and thousands of staff employed. In September, ACF announced $300 million in early childhood funds to states and territories that can support early childhood workforce initiatives, program quality improvements, and service delivery. Of that, $30 million will fund a new National Early Childhood Workforce Center to support research and technical assistance focused on increasing compensation and benefits and supporting recruitment and retention of an effective and diverse pipeline of early educators. The new center provides an opportunity to support workforce innovations through a joint integrated approach to research and technical assistance. Additionally, ACF released new program guidance that directs states, territories, tribes, and community organizations to increase compensation and benefits for early childhood educators who participate in one of several ACF programs. There's much more for us to do, and we will continue to be laser focused on workforce issues, and you'll see that commitment as we develop new guidance, regulatory proposals, and funding opportunities in the coming months. Today's session is an important piece of this work, and I hope that you all will all leave today with actionable information and know that we at ACF are listening and will use the information from today's session as we work in partnership with all of you. Thanks for being here, and thanks for your commitment to our nation's children and families. Deborah, I think I'm turning it over back to you.
Yes, thank you, Principal Deputy Assistant Secretary Hild. I greatly appreciate you offering those remarks and sharing the focus of ACF's commitment to ensuring that we have action items after today's conversation. With that, I will introduce our Office of Regional Operations Director, Carlos Williams, to introduce our plenary discussion. Carlos?
Thank you, Deborah and Jeff. I'm going to be introducing our very important plenary panel to you all today. We've got some wonderful folks who have been working in this field for a number of years, and they will share with you information that will be helpful in the work that you do in providing services for vulnerable children and families across the country as it relates to workforce issues, so that there's a workforce that's in place to provide those services. And you'll hear today some examples of promising practices that have been put in place by our speakers, and hopefully we'll have a vigorous conversation during our breakout sessions to explore some of these opportunities for successful engagement. Our first plenary speaker that you'll be hearing from is Timothy Ewing. He's the regional economist from the Bureau of Labor Statistics, United States Department of Labor. Our second panelist is Bonnie E. Frazier, Esquire, Deputy Commissioner for Policy, Legal Affairs, and Compliance from the state of New Jersey. Our third speaker is Daniel McKelkey, who is the Director of Human Services, Douglas County, Colorado, and President of the National Association of County Human Service Administrators. And our final speaker, Dr. Carmen Gonzalez Magus, is the Secretary, Department of the Family from the wonderful territory of Puerto Rico. The facilitators for this plenary session are our great regional administrators from two of our regions across the country. The first is Alfonso Nicholas. He's the regional administrator in Region 2, New York, and Christy Applehans, Region 7, Kansas City. So I'll be turning the mic over to these two great folks, and we'll begin our session. Thank you.
Thank you so much, Carlos, and welcome everyone. We are going to kick things off with Mr. Timothy Ewing, who will provide an overview from his perspective as a regional economist for the Bureau of Labor Statistics with the Department of Labor. Welcome, Timothy.
Hello. Good morning, good afternoon, depending on where you're at. Thanks for having me today. As just noted, I'm going to provide a very quick and brief overview of the human services workforce. I am with the BLS. For those that are familiar with the BLS, we're the principal fact-finding agency for the federal government in the broad field of labor economic statistics. Basically, right now, you can turn on any major media outlet and you hear talk on strong employment, high inflation, or rising wages. They're usually citing BLS data. A lot of us are paying attention to the announcement coming out later this afternoon on the Fed rate, expected change in that increase. And that's usually focused on the employment and inflation as well. Another topic that's really strong, and a couple of the speakers have already mentioned, is how tight the labor market is. And that's where I'm going to start today's presentation on. Next slide, please. So yesterday, this is fresh off the press. The job opening and labor turnover survey came out yesterday from the BLS, representing September numbers. It was a little bit stronger than we thought. Our expectations, it came in at 10.7 million job openings. Of that, there were 2.1 million job openings in the healthcare and social assistance sector. That was about 115,000 increase from August. So a lot of job openings, and that's signifying a strong market still. What this chart is not showing is the job openings. What it is showing is a very good illustrative example of how tight the labor market is. It's the number of unemployed persons per job opening. You see in the right-hand corner, We've got September 2022, we came in at 0.5, which actually declined from 0.6 in August of 2022. Basically, what that is saying is that there is actually, for every unemployed person out there, there's 2 job openings. So we don't have enough people out there actually actively looking for work to fill each of these positions that we have open. In an ideal world, we'll have one straight line hitting around the 1 mark, 1-to-1 ratio, right? But so far right now, we have a pretty tight market. During a height of recession nationwide, we were looking at 5 unemployed people per job opening. So not a lot of slack then, or a lot of slack in the market then. So we're tight and have been tight for recent months. We've been hovering around 0.5 and 0.6 for several months now, dating back to July 2021. Even then, if we look back further, prior to the pandemic, you can see we are already in it. The U.S. labor market was already in a tight labor market for the 2 years prior, sitting around 0.8 in February 2020. So we're just going back to that, and we're just seeing a little bit more tight of a market. I think the recession kind of changed a little bit of the mentality of some of this in the labor force. We're also seeing baby boomers leave the workforce as well. So there's a lot going on in the labor market today. Let's look overall at the social assistance sector. Next slide, please. And here we got the employment levels for social assistance, which kind of makes the components of this will actually make what a lot of the social or the health human services workforce falls into. You can see in September 2022, since the recession, we have been getting jobs in this particular sector at 4.3 million. That represented about 179,000 jobs gained year over year in September 2022. However, during recession, which would be March and April 2020, this particular sector actually lost 700,000 jobs, and you still have failed to recruit all of those jobs. You're well on your way to it, but you're still below that February 2020 peak. So let's look at some of the components within this particular sector. Next slide, please. And there's really 4 major sectors, or industry groups, I should say, that make up social assistance that we actually track on a monthly basis. At the very top, what we're looking at really is the change from pre-recession levels, those peaks since February 2020, see if these particular groups have added jobs or if they're still trying to recoup those jobs lost. As noted earlier, we still haven't recouped all jobs. We're still down 35,100 in regards to social assistance. But 2 areas I want to really focus on, 2 that might be of interest. Probably the big one right here for you guys, the ACF, is the individual and family services. So during recession, this particular industry group lost around 250,000 jobs over a 2-month period. Yet since February of 2020, it has recouped those jobs lost and actually has expanded, gaining 100,000 jobs. On the other end of the spectrum, we do have a couple of groups that are down. The big one is child daycare services. Still trying to recoup. They lost a total of 375,000 jobs in that 2-month period, and they're still down about 100,000 jobs in that sector. Quick note, these 2 together, child daycare service and individual and family service, are the 2 bigger sectors within social assistance, and they accounted for it was about 89% of all jobs lost during this past recession in the social assistance sector. Next slide, please. So if we were to zero in on the larger sector, which is individual and family services, this is by far the largest sector within social assistance. Now we have to go back a month. Some of these more detailed industries that make up that, the most current data we have is for August of 2022. This data actually comes out on Friday. October employment data, October employment data comes out this Friday. So all this will be updated as well. But you can see the largest sector within here is services for the elderly and persons with disabilities have added the most jobs, closing in on 59,000, followed by the other individual and family services. Now this is a broad kind of catch-all, right? That doesn't fall into these other sectors. And this is really those social assistance sectors or social assistance services not specifically directed toward children, elderly, or persons with intellectual or development disabilities. An example of these will be hotline centers, suicide centers, family social services, and parents and support services, among others. You can see we're still adding jobs in that. What we're lacking in gaining those jobs since we lost in recession is in the child and youth service sector, still down a little over 3,000 jobs. Next slide. So if we're talking about jobs, we're also got to talk about earnings, particularly when it comes to a sector that's having a hard time retaining workers or gaining workers, which is, as noted earlier, is across the board. Each of the industries are facing trouble getting people to come in these job openings. What we have here is the most recent average hourly earnings, broken by total private sector, social assistance subsector, and each of its components that make up the social assistance sector. Now, average hourly earnings are derived by dividing the estimated industry payroll by the corresponding paid hours. Is basically the return to an employee for a steady period of time on average for this particular industry. So these are industry averages, right? So it includes your supervisors down to your production workers as well. So if you're looking at these wages and think they might be a little higher than expected, that could be one of the reasons why. But you can see across the board, really stark difference is average hourly earnings for the health, human services sectors. All the components are well below the $32.36 average hourly earning wage for the private sector as a whole. Typically, two things I would like to point out is two industries. The lower wages are found in the services for elderly and persons with disabilities, as well as in the child daycare services. These are both falling below the $20 an hour average. And across the board, really, what you typically see is high turnover in these lower wage groups, right? In the housing recession we had back in 2008, we've seen people leaving the residential construction market, right? As that collapse, those people were leaving and going to manufacturing. As the economy started increasing, those people went right back into those higher paying jobs, particularly with that, the housing. And as a member of BLS, we got a lot of calls. We can see that. And you're seeing that across the board too. It's a lot more fluid and a lot easier for these individuals in the lower payer markets to transfer from one job to the next and one from industry to the next. You see it in leisure hospitality, you see it in retail trade, and you perhaps might be seeing it in regards to some of these industry groups right here as well. One of the things we have been noting and you have been seeing is increased wages across the board. Leisure and hospitality, retail trade sector are adding up increases in their wages. I think it was noted earlier. We're looking to raise wages for these particular groups right here to just not only attract the best talent, just to actually retain the talent, because turnover is costly for organizations and for employers. So you want to give them not just higher wages, you might be looking at other benefits as well. And with that, next slide, please. Looking overall at the long-term trend, this is a very interesting chart. So we're looking at actually two things right here. We're looking at consumer price index, the inflation, the impact it has on wages and take-home pay, as well as the average hourly earnings for the social assistance sector as a whole, and all the way up to the recession. Pretty in line, right? 2 to 4%, not too bad, not big dispersions. But you come into the recession, you see a spike, right? May of 2020. It was just technically coming out of the recession. You see a spike of 9.4% growth in the social assistance earnings. That's telling me two things. One, you're trying to attract workers, and it's probably harder too because it's really fresh off the recession. And these, I gotta imagine, are a lot of frontline workers. You're trying to get these people to come in and do work in probably uncomfortable situations as well. So you're seeing a 9.4% growth, which is very telling when I pulled the data for this, while inflation at the time was still pretty low at 0.2%. Coming out a couple of months, you see a little decline in the over the year increase in average hourly earnings for the particular the social assistance sector, while inflation continued to grow. And much like every other industry, as they're attracting workers, trying to retain workers, you can see the social assistance sector actually started increasing their wages as well. And you can see kind of plateaued recently in recent months, since dating back to August 2021. These wages have plateaued, but historically are still high, much higher than anything prior to recession, where you're hitting peaks around 4%. Now you're sitting around 7.1% growth rate for this earnings in this particular sector. Yet you can see here, we're experiencing historically highs in inflation, and we're not keeping up with inflation in regards to this particular sector. Not many sectors are. Inflation was coming in at 8.2 in August. The most current data for September is sitting around 8.2% as well. So next slide. If we were to look at all the components that make up the social assistance sector, you can see them here. Similar to the chart I had earlier, just laying out differently. So this is the average earning ranked by the 12-month percent change. And not surprisingly, in an earlier slide, we've seen where child daycare services, that particular sector, is still trying to recoup another 100,000 jobs just to make it back even to the February 2020 levels. It too is one of the lower paid jobs. You can see over here to the right, the column underneath average hourly earnings, it had the highest year-over-year growth in average hourly earnings at 8.7%. The only industry subgroup that actually surpassed inflation. Across the board, not surprisingly, most of your lower wage jobs sitting around the 20 and below had the highest average hourly earnings. These could possibly have higher turnover rates as well, while your more higher paid jobs at the very bottom, two that kind of really stick out, the very low two, are well below the private sector average at 5.2%, coming at 3.7% year-over-year growth in earnings is the child and youth services, followed by community food services as well. So I do know, next slide, please. That was a very, very, very brief overview. Typically with the statistics and data, usually only have an opportunity to provide the tip of the iceberg. So I hope in these 10 minutes I had, actually 12 minutes I had, I gave you some resources to fall back on. Here's my contact information. With that, I am going to pass the ball off to our next speaker. Thank you.
And
Well,
Alfonso, I'll have
yes.
you introduce the next speaker.
Thank you, Christy. The next speaker will be Bonnie E. Fraser from the Department of Children and Families. She will be focusing on the initiative that DCF have put in place, the strategies, in reference to they have made significant change in investment in staff well-being and undertaken many initiatives around the staff health and wellness, including standing up offices of staff health wellness, race equity, training, safety initiative. And these investments not only result in better services for most vulnerable children and families, but it helps to build staff capacity and retention. Bonnie?
Thank you, Alfonso, and I really appreciate the opportunity to be here today to talk to you all about some of the work DCF's been doing since 2018. At DCF, we are committed to seeing to it that every New Jersey resident is safe, healthy, and connected. But in all honesty, we can't do that work without an amazing staff of dedicated individuals who are willing to do whatever they can to support children and families. So in order for them to do whatever they can do, we need to do whatever we can do for them to make sure they receive the full support. And to that end, DCF is really striving to create a culture of safety and accountability with a commitment to fairness, equity, and wellness. Today, I want to spend some of my time talking about how we are approaching that work. So I'm briefly going to talk about the types of supports we're putting in place for staff, and that really includes creating our Office of Staff Health and Wellness. In addition, I want to talk about some of our development initiatives, which includes creating space for staff to focus on their own physical and mental well-being. And as Alfonso indicated, I'm also going to spend a few minutes talking about our new Office of Diversity, Equity, and Belonging. That office is taking the lead in all of our race equity work. So we can discuss these, and there are other initiatives, we're very busy, in greater depth during the breakout session, or if you would like to reach out to me after this session, my contact information is also included on the final slide. Next slide, please. So I think by now we're all familiar with the fact that employees in good overall health are more likely to deliver optimal performance in the workplace. So with that in mind, I'm just having problems scrolling, excuse me. With that in mind, knowing that child protection work can be intense and emotionally taxing, staff health and wellness was lifted up as one of 4 of DCF's transformational goals in our 2019-2021 strategic plan. And so in service to that goal, DCF established an office to focus exclusively on staff health and wellness and appointed an executive director. The office's purpose is to provide staff with resources and supports that foster overall physical and emotional well-being, strong morale, and a culture of empowerment. Other initiatives that the department has undertaken include the Worker-to-Worker program. This is a confidential peer support program to help staff manage the unique stressors of frontline child welfare practice. This program provides a place for staff to seek assistance outside of their supervisory structure. And during the height of the COVID-19 pandemic, Worker to Worker also hosted an 8-part wellness webinar series that addressed social, emotional, financial, and environmental stressors, among others. And then for staff who might not be comfortable with Worker to Worker, we have another option for them. Employee Advisory Services is organized by the State Civil Service Commission, and it's designed to help employees and their dependents with personal, family, or work-related issues that may adversely impact their work performance. EAS services are confidential, and staff may access counseling and referral services through that program. In addition, DCF has really heightened its focus on staff's physical safety in the office and in the community. To enhance our CPS work and improve our interface with law enforcement, we've established a security office, and we now employ 9 security officers. These individuals are all former law enforcement who are assigned regionally. They provide consultation, training, and emergency response services to the staff in not just our CP&P offices, but to all of our DCF offices that are located throughout the state. We also procured an app called Safe Signal, or it was called Safe Signal, now it's called Alert Media, which is something that staff can use to identify their location, their address, and if there is an emergency that occurs while they are visiting a family or walking around in the world, there is a touchless way to activate an emergency. A call center will then refer that call to local law enforcement who can respond. So it's invisible to whomever is with the individual staff person. It's a really great service, and we encourage staff to use that on their personal phones in their personal time as well. And finally, we have also spent a great deal of time training staff on safety science, which is an approach to critical incidences through collaborative safety. And what that's doing is moving us from a culture of blame to a culture of accountability. We want to learn from what occurs. We do not want to penalize our staff. Next slide, please. And then led in part by the team in the Office of Staff Health and Wellness, DCF has embarked on several initiatives to provide staff with resources and supports to reduce stress and foster their overall well-being. One of the very first projects coming out of that office was something called a mindfulness toolkit. Toolkit's available online and accessible to all staff, whether they are working in a DCF office or at an alternate work location. And I talked a little bit about Worker to Worker, but I think it's really important to note here that during this current administration, the contract for Worker to Worker was significantly expanded. The counseling and one-on-one supports that were formerly only available to CPS workers are now available to all 6,400 DCF staff. And in addition, the team from Worker to Worker leads regular webinars and weekly drop-in sessions for staff and monthly drop-in sessions for managers. 2 more staff-focused initiatives from the Office of Staff Health and Wellness include DCF Real Talk and DCF Connect. DCF Real Talk is a monthly discussion with staff to discuss common and recurring themes that come up in the workplace. We also use this time to share new initiatives or remind staff of existing policies. And then DCF Connect are monthly activities that are facilitated for staff by staff. We have lots of talented people in our department, and we're taking advantage of their experiences and their skills so that they can share their learning and their knowledge with others. Examples of some of the topics we talked about include mindfulness activities, Pilates, breath work, learning how to utilize technology more efficiently, etc. And please keep in mind that both of these products are available online through Teams, streaming to all staff. We send out a calendar monthly with the times and dates of these activities, and then we also send out invitations to staff, encouraging them to attend. And while doing all of this, we are also continuing to invest in our staff. For the first time in the department's history, we are investing in our middle management, and we piloted this year a leadership training, and it was incredibly successful, and we will be introducing that to 3 additional cohorts next year. And we are also providing all staff in the department access to training that is offered by the New Jersey Civil Service Commission called the Center for Learning and Improving Performance. Staff can, at their own pace or whenever they feel a need, can access the training that's available there. And the training runs the gamut from very short TED Talks on particular topics to information about how to use Microsoft Excel or any of the other products that we use. And finally, the other thing we've done to really solidify our commitment to staff health and wellness is to create a health and wellness element of our performance review system. So in 2023, for the performance review cycle, all staff will have a health and wellness goal as part of their rating system. And the intent there is to create space for supervisors to have conversations with staff about available supports and services. It's not enough just to make the services and supports available. It's incredibly important that we have dialogue with our staff and encourage them to take advantage of it. Because I think you all know that just because it's available doesn't mean staff will feel like they have the time and the ability to take advantage of those opportunities. Next slide, please. And then finally, I wanted to talk briefly about our race equity initiatives. So upon rejoining DCF in 2018, Commissioner Beyer conducted a listening tour with families, women, men, and youth participating in DCF's programs and services. She spoke to over 500 individuals. One of the recurring themes was topic of interest was race equity. And after some internal and external research, we learned that nationally and in New Jersey, children of color are disproportionately placed in out-of-home care through child welfare and behavioral health systems. As a result, we knew we had to make some changes, and we added race equity as a core approach in our strategic plan. And to date, we've engaged in quite a bit of activity in this space, and I can't go through each one, but I will briefly share a few. We established a race equity steering committee in 2019 to study our data and our policies while researching best practices and engaging experts in the field. We have contracted with several renowned race equity and child welfare experts to advise that committee and to provide foundational training to all DCF staff. As a result, all DCF staff have been trained on implicit bias, and every DCF staff member has been trained by renowned race equity expert, Dr. Jessica Price, in how to transform child welfare through a race equity lens. And we are also working with Joyce James to conduct a groundwater analysis to look at the source of racial inequities. And we are in the process of developing recommendations for eliminating those inequities. As Alfonso mentioned, we established an office of diversity, equity, and belonging in March of 2021. And the purpose of this office is to advance policies and approaches that prioritize a work culture that is respectful of the unique needs, perspectives, and potential of every team member. And finally, we also have established a diversity officer in our Office of Human Resources who monitors the hiring and promotional practices of the agency to make sure that they are equitable. And that's not all, but I'm sure I'm over time. I hope there's something here that piques your interest or that you can take away to use in your own organization. I thank you for your time and attention, and I look forward to an ongoing dialogue around promising practices for the human services workforce.
Thank you so much, Bonnie. That was fantastic. And one of our goals as we were planning this event was to not only encourage sharing across geographical regions, but to also encourage sharing between different levels of government. And so with that, it is my pleasure to introduce our next speaker, who is Dan McKelkey, who is the Director of Human Services for Douglas County, Colorado. And he is also the president of the National Association of County Human Service Administrators. So he gets two jobs, just like me. And so welcome, Dan. We look forward to hearing from you.
Good afternoon, everyone. Thank you for taking the time to be here. I'm looking forward to the conversation. We'll just begin. Next slide, please. So today I'm just going to give a brief overview of some of the things that we're doing here locally in Douglas County. For those of you who don't know where Douglas County is, we're a suburb of Denver. We are a true suburban community, but we are generally one of the fastest growing counties in Colorado. So with that, our workforce is growing at a pretty significant rate. commiserate with our growth and need in our community. Next slide, please. So for the last 10 years, we have participated in, or we've administered an anonymous staff survey. And it is truly anonymous that goes out to all staff. And we generally have a really good response, somewhere around 85 to 90% of our staff respond. And the only rule in it is that you can say whatever you want constructive about me, the director and the deputy director, but we're going to post whatever is written, but we're also looking for constructive ways for the department to get better through supervision and teams. We normally have a really long survey. This year, I was assuming that everybody was looking for a new job. So I started the assumption out for the survey with that. And myself and a group of team members write the survey. And this year we wrote it really is about why do you stay? And how is your personal well-being been in the last 6 months? And there were a couple of other questions, but it really was about 5 questions total compared to about 10 or 15 years before. So I'm not going to be able to compare and contrast like I normally would like to, but again, I was working from the assumption that everybody was looking for a new job. And it wasn't surprising to me, but the overwhelming response as to why people stay in Douglas County Department of Human Services is because of their supervisor and the camaraderie of their team. Some of the comments that we received were how much more difficult the people that we're serving, their circumstances are. I think Timothy talked about the recession. Our staff feel what is going on in the community, whether it's in child protection or whether that's in the eligibility programs. Our staff feel the stress and the issues that are going on in our community. So focusing on what is working well and why do you stay was something that was really important to me. Next slide, please. So knowing that the supervisor, to me, is the most important position in the department, I believe that everything starts and finishes with the supervisor. We really wanted to look at how our supervisors were doing. We're a medium to large size county, so I don't have interface with the supervisors on a daily basis, and I don't know all the supervisors, but started to really try to learn about the supervisors, what was going well and what wasn't, and really looked at turnover on specific teams. Our team's supervisors having a lot more turnover than others, and I'm sure that none of you would be surprised by this. We definitely had teams that were turning over at a larger rate than other teams, and really wanted to try to understand why that was. Once we were able to dial in on that and the reasons why, we started to provide coaching and mentoring outside professional coaches for the supervisors who seemed to be struggling, and those who actually wanted it as well. We opened it up to others, but for those who were having a significant amount of turnover, we made it part of their performance plan. And I was really excited to see that the vast majority of the supervisors that took advantage of the coaching and mentoring really have gotten a lot better. We have seen a major decrease in their turnover, and we think that their teams are much stronger as a result. The other thing that I really wanted to understand more is what is good turnover. I often hear good turnover when it comes to employees who are more difficult. And my belief is that every employee that is harder to supervise isn't necessarily someone who needs to leave. So what equals good turnover? And we've had a lot of good conversations between the management team and the supervisor teams here in Douglas County about what does that actually mean? Because when I hear of someone who that is risen to my level, that could be someone who is more difficult, them leaving is not necessarily good for the department. So I wanted to understand better about what good turnover equals Inevitably, there are people who leave here that it was good. It wasn't a good fit for them. We weren't a good fit in general. So I really wanted to understand the concept of good turnover. Next slide, please. Some tangible things that we have done, as well as our county generally only recruits through the county website. So if you're moving to Colorado, you won't know who all 64 counties are. So sometimes it's just luck that you have people apply for the jobs here. So one thing that we did as a county is we did hire a professional recruiting firm to recruit even for entry-level positions. We've always used them for higher level management positions, but we're using them as for entry level positions. And I will say that in the 6 months we've been using this group, it has yielded a phenomenal increase in who is applying for our jobs here in Douglas County. And although it is expensive, I would tell you that we are seeing less turnover, better quality candidates. And so far, I would say it's a success. Another thing that we have done for supervision is we are piloting a second predictive analytics program that the second one is around supervision in child welfare specifically, really looking at the risk levels of cases that our supervisors are carrying, for them to be able to work with their team members on really low risk cases and high risk cases, specifically dialing into why is the intervention that we are providing to a family not necessarily working in high risk cases, and for low risk cases, what does the family need in order to be able to not have the department of the child protection teams involved in their families anymore. And we have seen also some really good outcomes as a result of really focusing on how to help families move out of the system. And if you are brought to the attention of the Department of Human Services for basic needs, fortunately in Colorado, the Human Services departments both have the eligibility programs and the protection programs. So we're able to help families receive the benefits that they're eligible for, just not through the protection program. Next slide, please. That is my quick overview for the day. I appreciate your time and attention, and I will move to the next presenter.
Thank you, Dan. It was great presentation, Dan. Next, we have Dr. Carmen Gonzalez Magas. She's the Secretary of the Department of Human Services of Puerto Rico. And she will be speaking in reference to programs that they put in place in reference to post-trauma growth and development importance of employees through psychological well-being and the workforce and the recruitment strategies that they have put in place. Dr. Carmen Gonzalez Magas.
Thank you, and good afternoon to all. Certainly here in Puerto Rico and the Department of the Families, we have been facing challenges and initiatives in recruiting and retaining a great team. I mean, it's an amazing team, a really compromised team, but certainly we have been experiencing different difficulties and amidst certain events that we have been going through in the past years. So for this, the department has been able to identify not only initiatives, but also the needs assessment to lead us to those initiatives and different programs. The department is composed of 4 administrations and the Office of the Secretary. We have 88 local offices in which we provide special services, and we are divided in 10 different regions. Next slide. Next slide, thank you. So throughout our organizational assessment, we have identified different human services or human resources challenges, including those that retain or to retain and the recruitment in human services workforce due to many factors, such as, for example, the government of Puerto Rico has an oversight board, which means that we face a fiscal and management budget restrictions. We certainly have low salary or lower salary wages in comparison with the states, due to an outdated government retribution and reclassification plan. There is still a disparity in federal funding opportunities due to funding caps. We face labor union requirements. We have an excessive caseload, and we have been facing many and different various years hurricane experiences. So it's certainly been difficult for us, not only to go past them, but to recover. It has been taking a long time, longer than expected. So for this, we took the task of completing and identifying the personnel's needs. For this, we accomplished different surveys, interviews, and throughout different focal groups. And next slide, please. And in here, I will take a little more time explaining. So for the needs assessment, we had a total of 1,379 of advanced workforce who voluntarily completed the survey, representing 75% of the active personnel at the time of the assessment. In addition, a total of 88% of the deputy administrators, the assistant administrators, and associate directors participated in a semi-structured interviews, and 100%, proudly to say, 100% of the regional directors participated in the focus group. The mixed analysis was guided by the triangulation of qualitative and quantitative data. And the mixed analysis was guided by the mixed analysis was guided by the triangulation. The objective was to cross-validate the findings that allowed contextualized conclusions and recommendations to address the organizational complexities of Advan and the readiness for change amidst the family first. The interlocking approach then was used to make the integrated meta inferences about the factors affecting readiness for changes in Advan. So the integrated findings are presented by, and here's the most interesting part. It was the organizational and work characteristics, the staff well-being and attitudes, the planning about change, the readiness and readiness for change, the regional differences, and the regression model. Which takes us to the strategies to really incentivize personnel on human services. So we were forced to be very creative and to develop new strategies to keep and recruit personnel in the human services programs. This includes programs, compensations, and collaborative efforts that have been established during the past 2 years. First of all, we have the wellness and mindfulness programs, which Alfonso was talking about. This helps address the consequences of the workload, the well-known burnout syndrome, and symptoms of secondary traumatic stress. Their program's goal include not only to cultivate and expand awareness, but also a compassionate posture and willingness to consistently experience and engage in meaningful personal behaviors. We also have salary compensations due to the COVID-19 pandemic. So the department issued a one-time deal salary compensation to 121 social workers and 21 social worker supervisors. This was divided in 2 different phases, and the total that they received was $4,800. We also had the view and the importance to retain employees in Advan. So Advan authorized a $600 monthly increase to all employees in that administration. Apart from that, we realized the importance of retaining and motivating our special supervisors and social workers in the special investigative units. So for the social workers, there was an increase from $198 to $366. And for the supervisors, we had an increase from $260 to $480 monthly. Finally, we've had well-being and workforce wellness workshops to highlight the post-traumatic and post-growth and development importance and keep the psychological well-being within the agency personnel. These include 4 sessions of 3 hours each. Also, we look for different initiatives that we had to implement to recruit specialized personnel during the past 2 years, and we will be having from the next 2 years also. So we've held university tours to recruit social workers professionals, held in 3 different universities, the Inter-American University in terms of the Arecibo campus, another one in the Inter-American University, but the San Juan and Metro campus, and the University of Puerto Rico. This program has impacted 200 students, social worker students, and the purpose of this project is to recruit social workers while they're still at the university. We also have an MOU with the Department of Public Safety, which seeks to give assistance and security for our social workers. And we are in the process of completing an MOU with the University of Puerto Rico with the help of your agency to offer grants to BA students and MA students for the or by the Title IV program for E. So we'll continue to pursue more and greater opportunities for our staff, our personnel. It's an amazing team, but we realize the importance of their job, what they do, their compromise and their sacrifice. So motivating them constantly is super important for us. That's it for now. We'll be speaking to you of the many other initiatives and programs we will be developing through the next years. And thank you.
Thank you, Secretary. Thank you very much for your presentation. Now I believe that we will move into, we will start to open the break rooms, break sessions, and everyone can select and to join the state level discussion or the county level discussion or the territorial discussion. Once you go into your break room, we will spend at least half an hour discussing strategies and best practices, so you can take something back with you at the end.
Hi, I see many of our folks are rejoined into the main session. I hope that you all had productive breakout session conversations. We are going to identify an individual who will highlight the discussions that occurred in your breakout sessions for room 1, state innovations. Our facilitator was Regional Administrator Alfonso Nicholas. Alfonso, if he's back in the main session, will you identify whom will report out from your breakout session?
We didn't get to identify because the conversation was very intense, but I had a couple of individuals that asked questions, and I don't know if they feel comfortable, talking about what was talking in the breakout session, but I can call their names, Jennifer or Nicholas.
Well, can you hear me all right?
Yes, we can.
Okay. Yeah, so it was a nice breakout room with a variety of questions. I mean, for me, I was certainly interested in the strategies that the state has done. I'm up in Bergen County, New Jersey, and I know the state has been pretty innovative in terms of both their telework as well as their compressed weeks. So I was interested in how that's going. The challenges for us here, we currently do not have a telehealth policy. We do have some room with extended day. Our challenge here, and it sounds like it's a challenge everywhere, is with more either licensed staff or senior staff. Recruiting for them, particularly if you're talking about a licensed clinical social worker or a licensed psychologist, has just been really difficult post-pandemic because of sort of the introduction or expansion, I should say, of telehealth, and people just have private practice kind of opportunities that just weren't around when you had to find a physical office. So I share the pain with the state on that one. We're having difficulty. And then I know, and I can let someone else speak to it, but there was also a lively discussion about, employee wellness and keeping caseloads low to kind of help, with the sort of overall work environment. And then one of the last things that I took away was what the state was doing in terms of supporting their staff by higher salaries and supporting their education through tuition reimbursement. We certainly do have tuition reimbursement here in Bergen, and we have been working a little bit on salaries as well as a way of attracting and recruiting and retaining.
Thank you, Nicholas. Thank you for your feedback. We appreciate it.
Well, thank you to our first breakout session. We will ask now for our room 2 local capacity, building a diverse and skilled human services workforce. The facilitator for that breakout session was Regional Administrator Christy Appelhans. Christy, will you identify whom is your spokesperson from your breakout session?
I believe it's me. So I know we're at time. I'll just hit on some of the themes. We also, like the first group, talked about the well-being of the human services workforce. Someone said workers really feel what's going on in a community, and that certainly hit home. We talked about the need to raise the professional level of staff and just acknowledge that positions are more complicated than they have ever been before. A lot of talk about how we can really almost market or brand the human services profession, how the next generation can see it as something that's not only a legitimate career choice, but something that's really a wonderful, honorable field to work in. There was a sense that all of the presentations were really on point. We talked about partnerships with academia and how that can help with the workforce shortage. And then a lot of the things that we hear regularly are challenges, trying to get background checks approved, looking at paid internships as a solution. So as soon as people come into the field of human services, they can also be paying their bills. The connection to childcare was brought up, that human services workers, like all workers, need high quality childcare to come into the field and really contribute at the level that is needed. And then there was a sense that we have tried to be everything to everyone, and that it might be advisable to get back to the basics and really see, and instead of asking people to wear so many hats, who do we want to be as a profession? So with that, I'll leave it there. There were so many great ideas and things discussed.
Thank you, Christy. I know the branding was definitely your idea. I know that topic came up in many discussions that we've had. With that, I will go to our last breakout group, Territorial Transformative Strategies, Building Trauma-Informed Approaches. Our facilitator for that group was Nicole Myers. Nicole, whom is the spokesperson from your breakout session?
Thank you, Das Johnson. So in our breakout session, we actually had to do reverse and facilitation because my room was primarily Spanish speaking and I was not. So I ended up taking advantage of the interpretation skills, and our fearless leader, Glenda Guerrero from the Department of Families Ad Fund, actually facilitated the discussion in Spanish. And so one of the big things that came out of our room, and I will turn it over to Linda to expand, was retention. And they went into pretty big, deep detail about strategies in order to really help build the momentum for staff across the board. We had great representation across the jurisdiction, so that was super exciting. And with that, I'll turn it over to Glenda. Glenda.
Hola, buenas tardes a todos y todas. Pues estuve trabajando en la acción de breakdown número 3, que es la transformación de los territorios, y comenzamos a hablar de hay que hacer una transformación del sistema de bienestar infantil, ¿verdad? ¿Cómo vamos a hacerlo? ¿Hacia dónde nos movemos? Tenemos que movernos hacia mejorar las capacidades y las atenciones para nuestros empleados, que son la primera parte presencial, así que importante. Una estrategia, hablamos de la retención, como bien dice Nicole, estamos teniendo unas situaciones de reclutamiento, y para hacer una fase de reclutamiento y retención tenemos que salirnos, ¿verdad?, de la caja y buscar unas estrategias distintas para poder hacerlo. Así que como la secretaria bien lo informó en la primera parte, hemos tenido que movernos nosotros hacia las universidades para buscar y hacer ese gancho con esos trabajadores sociales que están en adiestramiento, están en los comienzos de ser trabajadores sociales, para poder, una vez ellos salgan de la universidad, podamos reclutarlos en nuestra agencia. Así que, como otra de las estrategias que hemos tenido que hacer, estamos trabajando junto con la Universidad de Puerto Rico un acuerdo de colaboración donde podamos financiar el costo de lo que es el trabajo social a niveles de bachillerato y maestría, para poder, una vez ese trabajador social salga de la universidad, inmediatamente llega a la agencia. Así que estamos bien prestos a trabajar con eso, y estamos locos porque esto finalice y podamos atender el asunto. Y como otra estrategia, hemos estado buscando incentivos y mejores calidad de sueldos y salarios para nuestros trabajadores sociales, que sabemos que han sido un poco bajos. Así que esas estrategias, junto con todas las que hemos tenido que hacer con la implementación de Family First, que estamos trabajando los programas de bienestar para los empleados, estamos trabajando también apoyando al que apoya, porque obviamente tenemos que estar bien nosotros como fuerza laboral para poder atender nuestras familias, nuestros niños, y Puerto Rico ha sido un ejemplo grande de eso por todas las situaciones que hemos atravesado desde el 2017, tanto en los terremotos, la pandemia, en los huracanes. Así que hemos sido bastante resilientes en esto y hemos tenido que atender nuestros trabajadores sociales para poder atender nuestras familias. Así que eso es bien importante, la atención plena y ese programa de bienestar para nuestros trabajadores sociales y nuestros empleados, para poder tener una fuerza laboral fuerte y que podamos obtener lo que realmente queremos. Así que gracias por la oportunidad de poder estar aquí con ustedes hoy en la tarde.
Thank you. I really appreciate the opportunity to have both translations on our webinar here. With that, I will conclude our webinar. I greatly appreciate all those who have taken the time to participate. And we look forward to getting back to you with all of the results from this discussion.
And we regroup in 6 months.
Thank you.